Now we change our instruments to this resection loop. This is the instrument we make bladder cancer procedures to resect the bladder and fulgurate the base of bladder tumor. So we are now marking our borders. When we begin fulgurate, the view of the tissues may change. So we previously mark, for example, this is the ureteric orifice and leukoplakia came closer. I don't want to touch this part. So I mark it not to pass the border. It's very clearly seen. This is healthy tissue. This is abnormal tissue. There are also some tissues here. This is the most important part of the procedure. If you do too less, there may be recurrence or the procedure may be ineffective. If you do too large, too wide, then recovery will be very painful. The extent of the procedure is important. And one important thing is the deepness of the procedure. How deep we must go. I don't hide it from anyone. It's in my videos. Every time I try to show it, anyone can do the procedure. This doesn't need too much skills for a standard urology doctor. Just to look and to see, it's possible. Usually the upper part of the urethra doesn't have these tissues because with the gravity the bacteria goes down, but here in this lady it is too extreme and I can see there are some tissues in the upper part of the urethra, so it must be always checked. This here you see there is an abnormal tissue in the upper part, which is very unusual because normally with the gravity here also there are some tissues in the upper part. This is very unusual. So we have to check every part. Very rare, but still there are some tissues in the upper part of the urethral or this bladder neck. Okay, after marking our borders, before resection, I try to scratch the tissues like previously in one of my patients. When I scratch these, they go away. But here they are stuck, more resistant. So I will fulgurate them. During fulguration, I want to be as superficial as possible. This is one important step. If it is too superficial, as you see here, they didn't go away yet. I have to be more deeper than here. If they are a little more resistant, this lady has the issue for many years. So we have to understand if it is gone, the fresh tissue has come from beneath. So when fulguration begins, the tissue appearance a little confusing. That's why I am marking it previously. I have to be sure that they all gone. Here still we need deeper fulguration. I want to see the fresh base of the scar tissue. This is not fresh enough. Now, I will all fulgurate these areas again. This is a real difficult case. They don't go away instantly. We have to be very careful to cure. And when I fulgurate deeply, the recovery will be longer. But anyway, whatever it takes, she will heal if we do it right. Still, this is not enough. These are not enough still. I have to fulgurate deeper. Suya da bakarsınız. Sudan sesler geldi de o susuz kalacağız. Birazdan. Yes, this is really difficult. These ladies usually suffer for a very long time, and many antibiotics have been used previously. This is ureteric orifice. Fortunately, it's healthy. The tissues do not extend through the ureteric orifice. You have to understand more about this disease. Why some people are having this disease and why others not. There are many. There is a long way to go in the treatment of this disease or prevention. Treatment is at least possible like this, but to prevent the disease from happening, there are really many things to be understood. We are in the beginning of the road. Okay, so now, still not over. Every patient is different. These are borders for healthy tissues. How I go deeper, when I see some suspicious area, I fulgurate longer. When I fulgurate longer, I know the deeper tissues are fulgurated. Then I have to have a normal looking appearance. Here you see when I fulgurate the tissue, here these tissues are leukoplakia. They have to finish now. Awesome. So I'm now looking to upper parts, which is very difficult to look here. It's very difficult to see, but there are some tissues in the upper part also. There is C. I will not see these tissues previously if I operated here. There are tissues. These are leukoplakia. Upper part is very difficult to see, and the experience is important in these parts. Maybe I would not succeed to find them if I was in the beginning of my experience. Here, look at this. These are rarely seen leukoplakias. It's not easy to understand, find them, because our instruments are not good at these parts of bladder, upper part. But definitely there are tissues here. Very difficult to proceed here. And these are the most important parts. If we leave some residual tissue here, maybe the healing will not be complete. Really embedded. Look at this. Inside the mucosa, there are islets of the leukoplakia. Difficult to find out, difficult to manipulate, difficult to fulgurate, but necessary. I was expecting this study to be difficult, but I was not expecting this to be difficult. Because I'm very surprised to see how many antibiotics she used. She's carrying a port for IV antibiotics. She's treated by any kind of antibiotic, and they didn't work. She has continuous pain, frequency, everything. Now these parts are healthy. I'm searching. Look at this. Look at this. Here there is an islet of leukoplakia. If I miss this, it's in the, let's say, 2 o'clock position of the bladder neck. It's very difficult to find. Usually we find tissues here in the trigone. But any part of bladder entrance is prone to get this infection. If you miss this, maybe she will not get complete healing. So we have to get rid of these embedded things. But it's, as you see, very superficial. I don't make deep resections, deep treatment. It's enough. This superficial treatment is enough. And I am checking all the bladder neck very carefully. Even I see nothing here. There may be some embedded here. I don't have to take a risk. I treat them. These parts looks more healthy. So when I fulgurate more and circumferentially I fulgurate the bladder neck, she will have a tough recovery. Look at here. They are fulgurated, but there were some tissues. She will have a tough recovery, really. We will see, we will understand how will be the healing. Look here. Very difficult to find. If you don't find this, I don't know. Here, very difficult place. In the bladder neck, upper portion, like 11 o'clock position or 9 o'clock position. I am happy she came to me in my experienced times. I could not treat her this good in my previous less experienced times. Still, there are here some tissues in the upper part, very difficult. Look, when I fulgurate, they come out, the embedded things. Look, these are embedded tissues. I search if there is any abnormal tissue. Here it looks like a little abnormal. Maybe it will have in the future, so I don't have to take the risk. Now I am more satisfied. Looks better. We just see by our camera with the magnified vision. Normally this loop is 7 millimeter. We see it like 14 centimeter, maybe 20 times bigger than normal. So bladder neck is okay. I am satisfied. Now I will move into bladder again. There are some untouched parts. I will touch them anyway. And again, here are some issues.
Great.
Here there are the fulgurated particles. Look at these. They are all leukoplakia remnants. They are in bladder. We will clean them like a vacuum cleaner. We will wash the bladder. I let them gather in some part of the bladder. Here, for example, yeah. They are all coming out. Our instruments are for these. We use these instruments in treatment of bladder cancer every day. We know how to clean, how to fulgurate, how to take the tissues out. It is easy for all urologists. All urology doctors can. This doesn't need any skill. They are coming out easily. I can do it under vision or blindly. I can wash the bladder. I will wash it anyway. But before washing, I want to see there is no residual tissues as much as I can see. They gather in the bottom of the bladder. With the gravity, they fall into the bottom and we take them out like this. Sometimes also in upper parts. Yes, the bladder is emptied now. If I look here like this, it is emptied. But wash the bladder with our special instrument. These instruments are used in bladder cancer cases. We wash the tissues out like that. And this washing is very helpful for cleaning the bladder. It is, if there is any residual bacteria, infected tissue, this will clean it. So we wash it. Like this, very important.
Güneş gözlüğün var mı senin? Uzun böyle.
So this mechanical effects also helps us. It cleans the bladder very nicely. Yes, there are some tissues here at the bottom of our case. Şunu da gösterin arkadaşlar, çekebilirsiniz. There are tissue debris and leukoplakia particles. Now I look at the bladder base. Here we need some more deeper fulguration. I can understand it only by experience. So I want to see fresh, bare tissues. Suyu değişelim. For example, here there are still some embedded tissues. So we are making deeper resection. Deeper we make, the recovery will be longer. I know it, but no problem. We have to get rid of this now. There are some concerns. Can you give any harm to my bladder with this procedure? No, I have many experience for many years. I never experienced the bladder like making a hole in the bladder or contraction of bladder. No, never. But still, I can't do this fulguration forever. I have to stop in somewhere and let the tissue heal. Maybe this is one of the most difficult cases I have ever seen. Maybe she will need another one, another fulguration. We will see, but I'm sure she will get rid of these infections very nicely. So now it seems better to me. I can't say I am 100% sure everything has gone, but it's pretty clean now. I took biopsies from maybe 100 cases in over 500 procedures. All of them had the same result. No tumor, nothing, only infected tissues. So I don't routinely take biopsies. Because it makes deeper holes in the bladder and healing is longer. I saw the lady before the procedure and checked with ultrasound that these tissues are thick. Normal bladder wall is 5 millimeter in thickness. She has 7 millimeters. And I know I can do deeper fulguration in her. So some parts it seems to me more, look at here. There is an embedded tissue still staying here. This is ureteric orifice. We come to border. I feel like this is where I have to stop. We will leave her for healing. If needed, we can do procedure one more time. But this is enough for now. Okay. So, last controls. We wish all the bladder to be healthy as these tissues. Healthy over there, healthy over here. And this portion will heal. In the urinary tract, still there may be some differentiated tissues, but I can't fulgurate this part, they will heal. So I look down to vagina on the last part of the procedure. It seems quite normal. There are some discharges here. And the opening of the cervix, there are some real discharges. They are considered normal usually. And here, opening of cervix, there are some issues. I don't think they are too much serious. Gynecologists consider them quite normal usually. Suya da bakalım. And they are quite normal. Okay, this part, I will ask for gynecological consultation for sure. But I don't think this lady has too many issues about this cervical issues. Here, some tissue changes. Gynecologists will comment on this. Okay, this is enough.